Hello everyone, this is Raju demonstrating the interior of the skull. We will study the interior of the skull under two sections. One is the cranial vault, which has been removed from the skull. Here you can see, after removing from the skull, it will be appearing in this manner. So this is skull vault. You can call it as a calvaria even. So internal features we are going to study. Externally we have studied already under norma verticalis. Again we'll see internal aspect. Here we can see the outer table, we call it as outer table, and this one is called as inner table. And here we can see the frontal crust, and below the frontal crust in continuation with you can find a depression. Here the depression is more prominent. You can call it as sagittal sulcus. Then here you can see certain depressions are there. We call them as granular foveolae, and along with that we can see the markings over the vault. So these are the vascular markings for various blood vessels and for the branches of middle meningeal artery and the middle meningeal vessels together. And here we can see the parietal foramina, and the remaining impressions for the cerebral gyri. Impressions are there here and there. You can find the impressions. They are for the cerebral gyri. And we just go ahead. Here we'll continue with the internal surface of the base of the skull. Here it is divided into three parts. One is the anterior cranial fossa. The middle part is the middle cranial fossa, and behind part, posterior part, is called posterior cranial fossa. Is a cranium. There are depressions step by step manner. This is a higher one, then the middle one, then the posterior one is the deepest one, we can call it as. So the anterior cranial fossa, middle cranial fossa, and the posterior cranial fossa. Here we can see the boundaries for this cranial fossa even. Here the anteriorly, in the middle part, if you observe the median area and the lateral area. For our convenience, we divide it into median area and we discuss under median area and the lateral area. The median area anterior cranial fossa consists of the prominent landmark called as frontal crust. In vault also we had observed, and here you can see, here this side you can see, this is called as the lesser wing of the lateral area. This is a posterior boundary, this is an anterior boundary. The frontal bone even, anterior boundary is under the anterior boundary is frontal crust, then the frontal bones. Under the posterior boundaries we can see the lesser wing of the sphenoid bone, and there are the anterior clinoid processes. Here it is removed, here you can find the anterior clinoid process. Then the posterior border of the lesser wing also we can see. So this is how the anterior cranial fossa has its boundaries. Here you can see the floor. The same median plane consists of the cribriform plate of ethmoid bone, cribriform pores like appearance can be seen, cribriform plate of ethmoid bone. Then the jugum sphenoidal. Jugum means neck. Jugum sphenoidal. So sphenoid bones, it's considered as a neck of the sphenoid bone. That's how it is called as jugum sphenoidal. And there is bilaterally, you can see here it has been removed. Now the orbital plate of frontal bone. Then the other features along with this cribriform plate of ethmoid bone and the frontoethmoidal suture can be seen. Frontal and ethmoid. Frontoethmoid suture can be observed here. Suture. Then the foramen cecum here, just between the crista galli and the frontal crust, you can see there is a foramen cecum. Cecum means blind. Blind foramen can be located. And anterior ethmoidal canals and posterior ethmoidal canals also can be located. Posterior ethmoidal canals. Here you can see posterior ethmoidal canals. And they are meant for the vessels and nerves which passes with the same name. And here you can see the crista galli, and through the anterior ethmoidal foramina, so numerous anterior ethmoidal vessels and nerves passes, and in the same manner posteriorly also. And in between them there are cribriform plate, so in which numerous foramina are there. So there are numerous foramina through which the olfactory nerve rootlets passes, through which the olfactory nerve rootlets will pass. Here we see the jugum sphenoidal, which separates, just below it there is a sphenoidal fossa, sphenoidal sinus, air sinus. And so this is about the anterior cranial fossa. Here you can see the lesser wing of the sphenoid bone and the free margin. The free margin divides exactly here. We can find the stem of the lateral sulcus of the brain, and here is the anterior clinoid process. And just below it you can find the superior orbital fissure, which is contributing, the lesser wing contributing for the superior orbital fissure, which is located here. We'll see in detail later on. Then here you can find the optic canal. Optic canal, it is forming the boundary for the optic canal also, the lesser wing of the sphenoid bone. This is about the lesser wing, the anterior cranial fossa, the remaining features. So if the fracture occurs in the anterior cranial fossa, definitely it leads to the black eye. The condition can be studied under the clinical anatomy in detail. So black eye, it leads to frontal cranial, anterior cranial fossa fracture leads to black eye, simple word. Then move to the middle cranial fossa, the anterior boundary by the lesser wing of the sphenoid bone, and the posteriorly by the superior border of the petrous part of temporal bone. And here you can see bilaterally the greater wings of the sphenoid bones can be seen. And the floor, if you observe, is formed by the sphenoid bone in the median region, and the squamous part of temporal bone. Here also you can see squamous part of temporal bone, both the sides. Then the anterior surface of petrous part of temporal bone. This is a petrous part of temporal bone. Temporal bone only, which consists of squamous part and the petrous part. Petrous means peter, means pattar, means rock like. So it's a petrous part of temporal bone. And the remaining features can be seen like, so here you can see there is a depression. You can observe the depression. So it's called as Sulcus Chaosmaticus, where it is lodging the optic chiasma. That's how it is called as Sulcus Chaosmaticus. Then we can see the sella turcica, and the optic canal can be located easily. Optic canal, we can see the optic canal. Optic canal can be located easily, through which we know that the optic nerve and the ophthalmic artery will pass through. And here you can locate the sella turcica. This depression is called as sella turcica. This, as it is Turkish saddle, we call it as sella turcica. Turkish saddle, elevation and depression to rest the foot. It's appearing like the sella turcica. So that's Turkish saddle. That's how it is called as sella turcica, which lodges usually the pituitary gland, hypophysis cerebri we call it as. In the middle you can see the tuberculum cell. These tubercles are the tuberculum cellae, and posteriorly there is a dorsum cellae, and the hypophyseal fossa can be located, and there are posterior clinoid processes even. Now we can see laterally the lateral area is depressed, and it is lodging then definitely temporal lobe of the brain. Here you can see the inferiorly it is connected with the infratemporal fossa. There is an infratemporal fossa just below this area, and here we can locate the superior orbital fissure. Here you can see wherever the probe is inserted, you can find a foramen just below the lesser wing and the greater wings of the sphenoid foramen, sphenoid bones. So this is called as the superior orbital fissure. Superior orbital fissure is a comma shaped one. Medial side is wider and the lateral side it is narrower. You can see this narrow appearance just below the lesser wing. This is subsided, so we have to trace it. Yes. So we just lift it up and we can get it easily. Here even we can get the common tendinous ring of Zinn also. And just below it you can get a foramen called as Foramen Rotundum. Foramen Rotundum is important to know. So through which the maxillary nerve passes. Yes, here the second important foramen. This is the Foramen Oval on the Nerva basalis also we had observed. The same one can be located here. The Foramen Oval, and just behind it is a small foramen called as, just in front of the spine, sphenoidal spine, we call as Foramen Spinosum. And if there is a foramen behind it, that can be for the emissary sphenoidal foramen of Agilis, we call it as, that is for the emissary vein specifically. Then the Foramen Lacerum can be seen from the just beside it, Foramen Lacerum, irregular foramen. So in Norma basalis we can observe it clearly. Here we can see there is a very important impression here. This is called as a trigeminal impression, so which also can be called as the trigeminal cave or Meckel's cave. And just behind it, so we can see there is a line like appearance. One is for the groove for the greater petrosal nerve, and another groove is meant for the lesser petrosal nerve. So groove for the hiatus for the greater petrosal nerve, and the hiatus are the groove for the lesser petrosal nerve as well. And just lateral to it, we can find in a eminence. In eminence, we call it as arcuate eminence, arcuate eminence. And just lateral to it, there is a plate of the bone, thin plate of bone. We call it as the tegment tympani. So there is a fissure even, the squamotympanic fissure we call it as squamotympanic fissure, and that is divided again into petrosquamous and the petrotympanic fissures. That is in the lower edge, they can be seen clearly, the lower edge. So they are very minute fissures. Then this is the cerebral surface of the squamous part of a temporal bone, we call it as. So under the clinical aspect, if there is any fracture in this area, it may lead to the bleeding through the ear, or even the CSF also can reach the ear, and the bleeding through the mouth or can be nose. So it is connected with the both nose as well as ear, that we can see. Now we are at the posterior cranial fossa, which is bounded anteriorly by the petrous part of temporal bone and posteriorly by the occipital bone. You can see the mastoid temporal bone, mastoid part also can be located here, and the dorsum sellae, which is called as this is a depression, can be this slope like area called as clivus, which is related with the basilar plexus of veins. I repeat, this is the petrous part of temporal bone, and posteriorly by the internal occipital elevation, protuberance, and this is our internal occipital crust. And the squamous part of the occipital bone can be seen, the mastoid part of the temporal bone bilaterally, and here we can locate the foramen magnum even. So now we'll see the remaining features. Here we can locate the internal acoustic Miatas. Internal acoustic Miatas can be located here, and here there is a jugular tubercle and the jugular fossa and the jugular foramen. So jugular foramen is here, jugular fossa is here, you can locate it. So the bulb is lodged here, and the remaining cranial nerves passes through this one, and this one 7 and 8 cranial nerves passes through the internal acoustic Miatas, and through this jugular foramen 9th, 10th, 11th cranial nerves will pass through. Here you can see jugular bulb. So sigmoid sinus. This is a sigmoid sulcus, and this one is the transverse sulcus. This is the confluence of internal occipital protuberance where the confluence of sinuses can be located. And here is a cerebellar fossa for the cerebellar hemispheres. And here there is a depression. Internal occipital crust is little bit divided and forming a fossa-like appearance called as Vermean fossa. And the transverse sulcus lodges the transverse sinus, and the sigmoid sinus sulcus locates the sigmoid sinus, and here the bulb, jugular bulb, will be lodged. Later on it will be continued as the internal jugular vein. The anterior condylar canal and the posterior condylar canals also can be located. So here nearby this sigmoid sulcus, you can locate the mastoid foramen also. From this side, the mastoid foramen. This is a mastoid foramen. The same can be located internally. So over the sigmoid sulcus. So there is a emissary vein connecting the sigmoid sulcus. Now we can see. So now we discuss about this. If there is a injury, the fracture over the posterior cranial fossa, definitely leads to bruising. And the attachments, regarding attachments, we'll see from anterior to posterior side. The frontal crust gives attachment to the falx cerebri, and the parts of the sagittal sulcus also. Crista galli also giving attachment to the falx cerebri, and the orbital plate. For the orbital plate, frontal lobe of the brain is lodged, and the anterior clinoid process are giving attachments to the tentorium cerebelli, and the medial cranial fossa, the temporal lobe of the hemisphere is located here, and the tuberculum sellae is giving attachment to the diaphragma sellae, and the hypophyseal fossa is lodging the hypophysis cerebri, and the dorsum sellae is giving attachment to the diaphragma sellae, even attachment, and the posterior clinoid process to the anterior end of the tentorium cerebelli. Bilaterally there are the cavernous sinuses even location, and over the superior border there is superior petrosal sinus location, and there will be attached margin of tentorium cerebelli even. And the medial part, yes, this is the medial part, compress, there is the depression. You can see this one is the trigeminal or the Meckel's cave, which consists of the trigeminal ganglion before its division into its branches. So here you can see the groove for the greater petrosal nerve and the groove for the lesser petrosal nerve, and the arcuate eminence even, and there will be semicircular canals below it. And now we see the posterior cranial fossa. We'll see locate, this one is the clivus where the basilar plexus of veins located, and the lower part of the clivus giving attachment to the apical ligament of the dens, and the little bit anterior to the foramen magnum and little bit lower aspect of the clivus giving attachment to the vertical band of the cruciate ligament and the membrana tectoria, and the internal occipital crust is giving attachment to the falx cerebelli, and the jugular tubercle and the groove they are grooved by the 9th, 10th and 11th cranial nerves, and they will pass through the jugular foramen. They will come out of the cranial cavity. Then here there is a subarcuate fossa. Here you can see the flocculus of the cerebellum is located. Flocculus of the cerebellum is located. And the majority of the structures of through various foramina we have studied under norma basalis from anterior to posterior. In the interior of the skull, you will see a few structures which are passing through various foramina. The foramen cecum is, as it is blind, it won't pass any structure as such, but occasionally it may transmit a vein which connects the superior sagittal sinus with the nose. and there will be posterior ethmoidal canals passes through the structures with the same name, and posterior ethmoidal nerve will not pass through this. So that is what we have to remember. Posterior ethmoidal canal does not pass the nerve with the same name, and the anterior ethmoidal canal transmits the same structures with the nerves also, anterior ethmoidal canal. And the optic canal, we know that optic nerve and the ophthalmic artery passes through the optic canal. Then the superior orbital fissure, here there was a superior orbital fissure, the orbital plate has been removed. Here also we can locate the superior orbital fissure. But what about the structures passing through this comma shaped fissure? The lateral part giving a passage to the lacrimal nerve, frontal nerve and the trochlear nerve along with the superior ophthalmic vein. So we remember that 3 nerves and 1 vein passing through this one, lacrimal, frontal and the trochlear nerve. And to remember, try to remember all these structures in an order: lacrimal, frontal and trochlear. So trochlear is the 4th cranial nerve and the superior ophthalmic vein as well. Then the middle part, this much part, giving structures passing through are the oculomotor nerve with its 2 divisions and the nasociliary nerve in between them. And here you can, along with that, the abducent nerve, the 6th cranial nerve. So now the cranial nerves are being covered. So here we are getting the 3rd and 6th cranial nerves, and laterally we are getting the 4th cranial nerve, and in between them there are the divisions. We'll see one by one. Then the inferior medial most part, or the medial part, giving passage to the inferior ophthalmic vein and the sympathetic nerve plexus around the internal carotid artery, only sympathetic nerve plexus. The foramen rotundum, we know that transmits the maxillary nerve, and the internal acoustic Miatas passes the 7th and 8th cranial nerves along with this labyrinthine vessels. So this is about the cranial cavity interior. So now we just revise the features once again. So summarize the things. The anterior cranial fossa bounded by the lesser wing and the frontal bones. In between the features we can see frontal crust and the crista galli, the foramen cecum. Crista galli and frontal crust giving attachment to falx cerebri, and the foramen cecum don't pass any structure, and the cribriform plate of ethmoid bone through which the olfactory nerves and rootlets will pass through, nerve rootlets, and anterior ethmoidal canal passes the anterior ethmoidal vessels and nerves, and posterior ethmoidal canal, no nerve, the remaining vessels will pass through. The orbital plate is lodging the frontal lobe. Then the middle cranial fossa, in which posterior anterior clinoid process gets the attachment of the tentorium cerebelli, and this cella turcica, the tuberculum cellae, optic canal, optic nerve and ophthalmic artery passes through this one. Then the jugum sphenoidal and the dorsum cellae, and here the diaphragma cellae was there. Then the hypophysis cerebri is located in the cella turcica, and the tentorium cerebelli, posterior clinoid process have been removed, and the petrous part of temporal bone. This is about the medial cranial fossa, and the temporal lobe is lodged here, and the superior orbital fissure, and the foramen rotundum through which maxillary nerve passed, then the Meckel's cave, trigeminal ganglion, the foramen oval and the foramen spinosum. The structures have been studied in norma basalis, and the superior petrosal sinus can be located, and the tentorium cerebelli is attached here, and the hiatus for the greater petrosal nerve, hiatus for the lateral petrosal nerve. Then the tympanic plate can be located, arcuate eminence can be located, and here the posterior cranial fossa with its boundaries, and the transverse sinus, sigmoid sulcus, sigmoid sinus, and the jugular fossa, jugular bulb, and the 9th, 10th, 11th cranial nerves in the jugular foramen, the foramen magnum, then the vermian fossa, internal occipital crust, and the internal occipital protuberance, cerebellar fossa for cerebelli, cerebellar hemispheres. And this is about the interior of the skull. Thank you very much.